In this episode, we are sharing our study engaging young people from Kent's ethnic minority communities with mental health research. My name is Glory Oluwasefumi Oluwaseun, and I have been working with young people from ethnic minority communities in Kent to co-create this podcast. This study is led by Professor Lisa Dikamitis, a medical anthropologist working with Professor Suki Shergill, a psychiatrist. Young ethnic minority communities face worse mental health outcomes, yet they are severely underrepresented in research. Our study explored perceptions and understandings of mental health and mental health research among young people from diverse minority backgrounds in Kent. Over the course of 1 year, I conducted fieldwork, including interviews, community engagement, and creative workshops. We held several podcast workshops and focus groups with young people at schools and universities in Kent. They recorded their thoughts in small groups, but what you will hear is a curated collection of their voices that reflects many of their conversations.
Because you sort of feel you don't have a place, because you're not Indian enough to be Indian, but you're not British enough to be British, because you're not, like, you're right in the middle, and it's difficult to explain that to your parents.
As a young person from an ethnic minority community in Kent, I understand what it's like to live at the intersection of several different cultures. This creates complex and multiple identity layers.
When I was about 6, my grandma, my Chinese side, took us to Chinese school so that I could learn Cantonese. And the principal, the lady running it, said that I wasn't allowed to join the school and learn because I'm mixed and I'm not fully Chinese. And I didn't really understand at the time, but now that really, I mean, it hurts. I feel connected but still disconnected.
Sometimes we encounter gatekeepers who deny us access to our own culture.
Being the oldest daughter in the African household, like, you're kept to like a higher standard, and if I don't meet those kind of standards, then it's kind of seen like I'm being disobedient. It actually plays a big toll on my mental health as well, because if I'm not able to talk about my feelings within my family and within my house, what makes you think that I'm going to be able to do it outside?
A lot of people are self-diagnosing themselves due to the internet and due to the extensive knowledge on the internet.
When, like, I was younger, like 15, 16, I probably used to follow a lot of, like, just Instagram, like, models, I guess. Just, like, girls who, like, they get sent, like, nice clothes and, like, makeup, and they post it, and I was like, oh, she's so pretty, I want to look like that. And, like, and I feel like it's a bit cliche, but I was very young and, like, impressionable, and so I had to take the, like, actual steps to think, like, is that really, like, healthy? Like, I go on my phone and I just see other people living, like, the perfect life, and it's all fake. Like, it's not even real. But I guess at the time I didn't really know that, so I literally, like, unfollowed all of them.
What you just said, like, you've got the agency to control what you see. Like, I'm not overly active on social media, so I didn't know that, for example, I had that agency. So I would go in and then come out feeling quite sad sometimes.
Describe your kind of household handled mental health.
They didn't handle it. They just like disregarded it. Like, mental health is fake to them, basically. But I feel like since I struggled a bit with mine, I guess they realised it's not fake, obviously, if it's affecting their daughter. But they didn't understand. They didn't understand what to do. So yeah, when I didn't even tell them. I don't like telling my parents about my issues. I still don't. I didn't tell them. They found out. So like when they found out, they didn't know what to do. I didn't know what to do. So like we were both just kind of stuck. And they thought the solution was taking away my phone. Obviously did not work.
Or it's your phone, innit? Basically, in my community, if you've got mental health problems, you need to sleep.
Why are you crying? Stop crying. Why are you wasting your energy? My dad had like the same view. Mum was also solution oriented, so she's also like, don't waste your time crying, you know, you can figure out the solution. But at the same time, she's English, so she's a lot more softer.
The difference is that I think Western culture is so much more open than Eastern culture with these sorts of things. Having that conflict has had quite a negative effect, I suppose. So I'm not sure which one I'm supposed to comply to. I also struggle to communicate with different sides of the family at different times because I've grown up with two halves essentially, and that has had adverse effects on me because it's generational, and so that stigma and that unwillingness to talk has been passed down to my side as well.
But yeah, I feel like still now, like it's still disregarded. I don't talk about it, they don't talk about it. But I feel like because they don't talk about it, they're the adults. It's like because that my whole life, like we grew up not talking about it. So obviously now when it comes, even when I'm talking about it with other people, I struggle because I never really express how I felt in my household.
Mental health what? Like mental health doesn't exist. Like it's not a thing at all. It's basically non-existent.
I've been lucky that my parents, particularly my father, has been very understanding if I have problems. Obviously understands me being a black man, what I go through sometimes. Because I think sometimes as young people, we kind of have a way of thinking that our parents don't understand what we go through. But speaking to understanding kind of their point of view is that sometimes learning about what my parents have gone through from coming from Nigeria and what they had to go through dealing with different challenges that will come living here. I'll say that sometimes they don't understand why you'll be quote unquote sad in the life you're living when they've come from way worse situations that we've come from, and they still find joy and community and family there. So I think that's one thing that I kind of think in my mind of why, just understanding that my parents have gone through way worse things than I've gone through.
Why do you think people think mental health isn't socially acceptable?
It kind of makes them look weak, especially because knowing like what our parents went through, it's hard for them to understand what we're going through mentally, because they went through stuff physically, maybe physical labor, immigration. Basically, we kind of look spoiled and ungrateful when we talk about it.
Brings that gap between generations. I think it's comparing experiences, because something that makes someone else upset or like going through that kind of struggle with their mental health might not be the same for someone else. So because your parents have been through, well, in their case, worse or what they've been through, doesn't mean that if something is affecting like us now, that might not be big compared to what they went through. It doesn't mean it still can't make you upset. So I think that could be the reason, one of the reasons that brings that gap between the generations.
I think I'm a very like emotional person. So like coming from like my parents raising me, I think it's become a thing of I have to be practical. Like if I'm in my feelings, I know that okay, fine, today I'm in my feelings, but tomorrow we get up and continue. So like I try to like apply that in my everyday life. Like if I'm sad, just stop being sad. Like try to keep moving. But I think these are things we do need to talk about.
I like kind of actively go against what my parents like try and tell me in terms of being super practical all the time, because when I try and talk to my parents about something, they won't even think about the emotion of it. They'll just say, well, what's your answer? And I'm like, okay, I know what the answer is because I'm the one with the problem. I just want a pat on the back and a well done for like thinking about it.
The conversations were punctuated with laughter, whether a tool to lighten the mood or blanket to cover the discomfort. Laughter was a repeated theme, but everyone had their own reaction.
That whenever you're upset, whenever that's something, like they always do, oh, why are you upset? Jesus loves you. This stuff. As a Christian, why are you upset? You know, and it's like, it's not that I don't know that stuff, but I'm still human. Like, can I not
Jesus
experience?
to be sad.
Exactly. Jesus wept.
Obviously, my sister suffered quite a bit. She had depression, so she her solution was go to church, pray, read the Bible, and then it kind of like worked for her in a sense, but then she kind of spiraled back, and then she kind of realized that professional help is needed, as well as if you are religious, it's okay to like read the Bible and stuff and find solace in God.
A lot of this convo has been, oh yay, mental health in West good and from where I'm from bad, but it's really not that way at all.
I was raised in Uganda, born in Nigeria, so I've never been abroad for like an extended period of time. So I found that the UK is a very lonely place. Like there's no community here, like nobody cares. Like as you're moving around, like everybody's minding their own business. Whilst in Africa, everybody's your mother and everybody's your father. Like everybody cares about your business. When I was in Uganda, sometimes it felt overbearing. Like the aunties and uncles are always talking, everybody's always calling you, checking up on you. But you realize that when you leave, you actually miss those things. Like here, nobody knows your name, nobody knows where you come from, nobody knows your history. If you're walking on the road and you're crying, nobody cares. Like there's just no sense of community in this place.
If they somehow embedded themselves in the community, or like picked a representative from a community that knew the community, knew how it worked, and encouraged them to like talk to other people and say, no, this isn't how it actually works in the NHS, or this isn't the purpose of that, just like a person to like debunk myths, or like like a myth buster. But it has to come from the community themselves, because trying to push it on people, they will never listen.
This podcast was a glimpse into a much larger study. We must listen to young people from ethnic minority communities. Influenced by our complex and multiple identity layers, we have a unique perspective that we can all learn from. Thank you.
I am Professor Lisa de Comitis, and with my colleague Professor Suki Shergill, I would like to thank our fantastic research assistant Glory Aluwashin for engaging so deeply with community members and making sure that we truly included a wide range of diverse voices in mental health research. We would also like to thank our funders, the NIHR's Clinical Research Network Kent, Surrey and Sussex, for their generous award. And most of all, we would like to thank our participants, all community members, young people for Kent's ethnic minority communities, and our patient and public involvement members for their participation in our study. You have shown us how we can ensure that mental health research must not be about you, but always with you. Your contributions were invaluable, and this work would not exist without you. Thank you. For more information, please look up our project website.